Stages of wound healing. We have 4 stages of wound healing. As you know, once you have exposed to any injury to your arm, this is your forearm. What is the first step to occur? We have 4 steps. First one is hemostasis. Second one is inflammatory. Third one is regeneration and reparative. Last one is remodeling. Each stage, we have cells and the time. You should keep the cells in each one and the time needed for each stage. First one is hemostasis. Once you have injury to your forearm and you have injury to the blood vessels running in it, once you have complete transection of these blood vessels will undergo spasm. Its ends will undergo spasm. This spasm will induce stasis within this blood vessel. This stasis will start by platelet. This platelet will go into their action. Platelet adhesion, platelet aggregation, then platelet thrombus formation. All of this function assist ADP, adenosine diphosphate, will also present by serotonin, associated with them thromboxane E2. So I have 3 factors will help the 3 functions of the platelets. Once you have a severe vasospasm, so you have a stasis. Here you will have injury to the wall of the blood vessel. So you have a platelet adhesion, aggregation, and thrombus formation. This will be helped by ADP, serotonin, and thromboxane E2. Here I have said cells, they are RBCs and platelet. Times just from seconds to minutes, you will have the hemostasis into your wound. After it, you will have the inflammatory process. And I said arrangement of the cells which are reaching the site of inflammation. PNMFA. PNMFA. This is the arrangement of cells which are coming to the site of the wound. First one is platelet and RBCs. And this is in the stage of the hemostasis. NMF are coming within the inflammation. They are neutrophils, macrophage, and fibroblast. Neutrophils, macrophage, and fibroblast. And the last cells which are by E, they are endothelial cells and epithelial cells. Endothelial cells and epithelial cells will come in the regeneration phase. So PNMFA, they are arrangement of cells which are coming into the wound inflammation. P for platelet and RBCs. NMF, they are neutrophils, macrophage, and fibroblast. In the regeneration E, I have endothelial cells and epithelial cells. Added to them in the remodeling phase, you have the myofibroblast. Inflammatory process, you will have the cells which are coming, they are neutrophils, macrophage, and fibroblast, and the neutrophils before macrophage. Neutrophils before macrophage. They are coming to the area of the inflammation to release some inflammatory markers and some inflammatory cytokines in the form of interleukin 1, interleukin 6, and the tumor necrosis factor alpha. All will be released to trigger the response to the inflammation by accumulation of macrophage and the induction for collagen deposition by the fibroblast. Then you will have the regeneration phase and remodeling phase. Regeneration, reparative phase, which is taking about weeks. You will have here the epithelial cells, and you have also endothelial cells, and you have continuation of the fibroblast. Fibroblast will continue in the inflammatory and the regenerative phase. Endothelial cells will start by neovascularization to induce neovascularization, while epithelial cells will start by collagen deposition in the wall of the wound, while also fibroblast will start by induction of fibrin to form a fibrin block. This is the regenerative phase. While in the remodeling phase, which may take from 6 months to years, this remodeling phase may take from 6 months to years, excuse me. Then you have what are the cells responsible in remodeling. First cell, and the most important cells, they are called a myofibroblast. Myofibroblast. How is remodeling occurred? Remodeling, you have two important information regarding it. Collagen 3 is transformed into collagen 1. Proline, which is a part formed within this collagen, is transformed into hydroxyproline. So here, 3 to 4 information regarding remodeling. It may take from weeks to years. Cells are responsible, they are myofibroblast. Collagen 3 is transformed into collagen 1, proline is transformed into hydroxyproline.